All right, so we're continuing with the human body. We were on the respiratory system. The respiratory system is divided into upper and lower airway. The airway consists of the nose, which can out, and the nose would be anterior, the nasopharynx would be posterior. You have the mouth, which is anterior, the oropharynx is posterior. So the nasopharynx is a posterior portion of the nose, the oropharynx is a posterior portion of the mouth. And you have the throat, which is sometimes referred to as the pharynx. The larynx is a voice box and it's an important landmark. Anything above the larynx is upper airway. Anything below it is considered lower airway. Below the larynx, you have the trachea, which is the windpipe, and then you have the passages within the lungs. These are the structures of the airway. And this diagram, so the other structure that you need to be familiar with, do I have a pointer? Yes, I do, is the epiglottis, which is a leaf-shaped cartilaginous structure that is just above the vocal cords. And the purpose of the epiglottis is to prevent anything that's not air from entering the lungs. So that's the purpose of the epiglottis. The esophagus goes to the stomach, and the esophagus is posterior to the trachea or windpipe. So the trachea is anterior and goes to the lungs. The esophagus is posterior and goes to the stomach. Now, within the respiratory system, oxygen and carbon dioxide are exchanged in the alveoli and tissue. And the exchange of oxygen and carbon dioxide, this is what we refer to as respiration. So respiration is the exchange of gas, oxygen and carbon dioxide. And this can occur within the lungs, and it can occur within the cells or tissues within the body. So there's something that is referred to as pulmonary respiration, which means the term pulmonary means lungs. So that's exchange of oxygen and carbon dioxide within the lungs or the alveoli. And we have what is referred to as cellular respiration. And that's the exchange of oxygen and carbon dioxide within the cells of the tissues. Now, during inhalation, which is the active phase of breathing, the diaphragm and intercostal muscles contract. The diaphragm and intercostal muscles are skeletal muscles that are important to the process of ventilation. So inhalation is active, exhalation is passive. Once you hear the term active, it means that muscle use is required. So when a patient is breathing in, muscles contract, specifically diaphragm and intercostal muscles. When a patient exhales, the muscles relax, specifically the diaphragm and intercostal muscles. What is the importance of this? It simply means that if you have a patient that is having difficulty breathing, and you can see muscle use when the patient is exhaling or breathing out, they're in trouble. That's not normal. and that would be the respiratory system. So let me just backtrack a bit, point out some important stuff. So what is important about the respiratory system? Need to know your upper airway structures, need to know your lower airway structures. The function of the upper airway structures is warm, filter, and humidify the air that we breathe in, WHF. The lower airway structures are responsible for moving air containing oxygen all the way down to the alveoli for it to be exchanged into, for it to diffuse into the blood. So in order for respiration to occur, which is the exchange of oxygen and carbon dioxide, a patient must be able to ventilate properly. And when you hear the term or see the term ventilation, it is specific to the mechanical action of breathing in and breathing out. So patient must be able to breathe in and out effectively. That's ventilation. And to know if a patient is breathing effectively, you observe their interaction with you and their chest rise. So there must be good ventilation. The other thing that must be met for the lower airway to function effectively, there must be good oxygenation. So enough oxygen must be present. If there is not enough oxygen present, there will be an issue with the movement of gas when it gets to the level of the alveoli. Once enough oxygen is present, that is what we would refer to as oxygenation. Now, specifically, oxygenation is specific to the red blood cells within the body. The ability of the red blood cells to bind to 4 oxygen molecules. So if a red blood cell is able to bind to 4 oxygen molecules, that particular cell is properly oxygenated. So the red blood cells are, their main function within the body is oxygenation. They house oxygen molecules, and that's oxygenation. Now, if there is good movement of the chest, meaning there's good inhalation and exhalation, there's sufficient oxygen present, then we will eventually get good exchange of oxygen and carbon dioxide. And that is what we call respiration. And the goal is to introduce that oxygen into the blood, which is then circulated by the heart to the rest of the body. Now, as the blood takes up the oxygen, it gives up CO2, which we exhale. So these are important things to just keep in mind. Again, ensure you're very familiar with the structures above the larynx and the structures below. Very important to know the role of the epiglottis and the position of the esophagus. And it is extremely important to know the difference between the active process of breathing, and the passive process of breathing. That's very important. So know when the muscles contract, know when the muscles relax. And inhalation is active, exhalation is passive. So inhalation requires muscle contraction, exhalation requires muscle relaxation. And that's all you need to know for the respiratory system. Now, the circulatory system. The circulatory system includes the heart with pumps, which pump blood through a network of blood vessels to all parts of the body. So the circulatory system consists of the heart, which is a pump. It consists of blood vessels, which are the pipes, and it consists of fluid, which is the blood and plasma. And the main function of the circulatory system is to circulate blood to all areas of the body. Now, the flow of blood. Blood picks up oxygen in the lungs and goes to the heart. So the only place that blood can pick up oxygen is from the lungs. Once the blood is oxygenated, it goes to the heart. Then the heart is going to pump that oxygenated blood to the rest of the body. When it is circulated to the rest of the body, the cells will absorb oxygen and nutrients from the blood and release waste products. The blood then carries the waste back to the lungs and the kidneys. In the lungs, the blood exchanges carbon dioxide for more oxygen. So this is pretty straightforward. It's a lot more complicated than this, but we're not going to get too complicated at this level. What is important to note is that the only place the blood can pick up oxygen from is the lungs. And once the blood is oxygenated, it is pumped by the heart to the rest of the body. When it goes to the rest of the body, the cells will take the oxygen and nutrients that they need and release waste products. And this is what we call perfusion. So the process of perfusion occurs. The waste is then returned to the lungs and the kidneys to be removed from the body. In the lungs, the exchange of carbon dioxide for more oxygen will occur. Now, looking specifically at the heart. The heart consists of 4 chambers. You have 2 upper chambers, 2 lower chambers. The upper chambers of the heart are referred to as the atrium or atriums. The purpose of the upper chambers is to receive blood. That's the main function of the upper chambers. They receive blood. The lower chambers or ventricles will distribute blood. So the ventricles are responsible for receiving and pumping blood out. Now, between the upper and lower chambers, because the heart have a right side and a left side, between the upper and lower chambers, that's the atrium, and the ventricles, there are valves. And the purpose of valves is to prevent backflow of blood, specifically backflow of blood into the atriums. So when the atriums receive blood, it pumps the blood through valves into the ventricles. And once the blood passes through the valves close to prevent backflow. Now, when the valves open and close, that is what we listen to when we're listening for heartbeats. So when we listen to a patient's heartbeat with a stethoscope, we're actually listening to the valves open and close. All right. Now, the heart has 4 chambers. The heart is divided into a right side and a left side. The right side of the heart is responsible for receiving and distributing deoxygenated blood. That's blood that does not have a lot of oxygen present in it. The left side of the heart is responsible for receiving and distributing oxygenated blood. Now, what happens is the largest vein, which is the vena cava, has a superior portion and an inferior portion. I always start on the right side, or the dirty side, as I will tell students. So the largest vein in the body, which is the vena cava, has a superior portion and an inferior portion. And the purpose of the vena cava is to receive deoxygenated blood from the upper portion of the body and the lower portion of the body. That blood is then pumped into the right atrium. That's a deoxygenated blood. The right atrium then contracts and pushes the blood through the valve into the right ventricle. Once the blood passes through the valve on the right side, it closes. Then the right ventricle pumps that deoxygenated blood up into the pulmonary arteries. Now, important point to note, the pulmonary arteries are the only arteries within the body that transport deoxygenated blood. The other important point to note is that all arteries transport blood away from the heart. So A in arteries is for away. Arteries transport blood away from the heart. So the right ventricle receives the deoxygenated blood, it contracts and pushes the blood through a valve within the pulmonary arteries, and then the pulmonary arteries take that deoxygenated blood to the lungs. When it gets to the lungs, at the level of the capillaries, at the same time that it reaches the capillaries, which are wrapped around the alveoli or ear sacs of the lungs, oxygen enters the ear sacs. So oxygen then diffuses into the pulmonary into the pulmonary capillaries, and then CO2 diffuse into the ear sac. So the blood is now oxygenated. Once the blood is properly oxygenated, it will now return to the left side. The left side is the clean side, the right side is the dirty side. So it's going to return via the pulmonary veins. So the pulmonary veins carry oxygenated blood from the lungs to the left atrium. Important point to note, the pulmonary veins are the only veins in the body that carry oxygenated blood. Now, when that oxygenated blood enters the left atrium will contract and pump that blood through a valve into the left ventricle. The left ventricle is the largest chamber of the heart. It is the largest chamber of the heart because it does the most work. The left ventricle is responsible for pumping blood up into the aorta, which is going to distribute that oxygenated blood to the rest of the body. So it does the most work. Now, the aorta is the largest artery in the body, and it has a ascending aorta and a descending. So the ascending is the top portion, descending is the bottom portion. The aorta transports oxygenated blood to the upper portion of the body and the descending aorta transport oxygenated blood to the lower portion of the body. And that's basically how the blood flows through the heart, and it is a closed network. So important points to remember. The upper chambers receive blood, the lower chambers receive and distribute blood. The right side of the heart carries deoxygenated blood, the left side carries oxygenated blood. All veins within the body carry blood towards the heart. So all veins carry blood towards the heart. All arteries is for away. Arteries carry blood away from the heart, and there is one exception. The coronary artery is the only artery that directs its blood flow towards the heart, because it is the artery that supplies the heart muscle with blood. That's very important. Now, the valves are present within the heart to prevent backflow. And when the valves open and close, that's what gives the heartbeat. That's the heartbeat that we're listening to. And to track the flow of blood through the heart, you need to pick a side. You can start on the left side, you can start on the right side. I always choose to start on the right side, which is the dirty side, right? And I'm going to go over it one more time and then we'll move on. So the upper portion of the body and the lower portion of the body receives deoxygenated blood from the upper portion of the body and the lower portion of the body. We have the inferior vena cava, which receives blood from the lower portion, and we have the superior vena cava, which receives deoxygenated blood from the upper portion of the body. And the vena cava is the largest vein in the body. The smallest vein would be the venules. Now, when the vena cava receives this deoxygenated blood, it's going to pump that blood into the right atrium. The right atrium then contracts and pushes that blood, which is deoxygenated, through a valve into the right ventricle. The right ventricle then contracts and pushes that deoxygenated blood through a valve into the pulmonary arteries. And you have a right portion to the pulmonary artery, and you have a left portion. The main purpose of the pulmonary artery is to carry deoxygenated blood to the lungs, where it will become oxygenated. That's the main purpose of the pulmonary artery. And the only arteries within the body that carry deoxygenated blood is the pulmonary arteries. All the other arteries carry oxygenated blood. Now, once the blood is properly oxygenated, it will be pumped from the lungs via the pulmonary veins, two coming from the left, two coming from the right, and that oxygenated blood will end up into the left atrium. The left atrium then contracts and pushes the oxygenated blood through the valves into the left ventricle, which is the largest chamber of the heart. The left ventricle then contracts and pumps that blood through a valve into the aorta, which is the largest artery in the body. The smallest would be arterioles. The ascending aorta will pump oxygenated blood to the upper portion of the body, and the descending aorta will pump oxygenated blood to the lower portion of the body, where the cells within the tissues will get the oxygen that they need and give up waste, and then the cycle repeats itself. So it's a closed network. Now, the arteries carry blood away. A is for away. So arteries carry blood away from the heart, with the exception of the coronary artery. So that's the exception. The arteries are referred to as high pressure vessels. They are high pressure vessels. Therefore, they have thick walls. There are three major arteries that you need to be familiar with as a EMR. The artery found in the neck, which is the carotid artery, very important artery for you to be familiar with. The groin area, we have the femoral artery, another important artery to be familiar with. And then you have the artery in the wrist, specifically the one that is in line with the thumb, that's the radial artery. And this diagram depicts the location of those arteries. Now, the capillaries. The capillaries are the smallest blood vessels within the body. And the importance of the capillaries is they connect the smallest veins to the smallest arteries. So that's the purpose of the capillaries. And when the cells move through capillaries, they are able to pick up oxygen and release CO2, and they are able to give off CO2 and pick up oxygen, depending on which side of the capillaries they are at. Now, what is important is at the level of the capillaries is one cell at a time can pass. One cell at a time. Now, the veins are thin wall vessels that carry blood back to the heart. So veins transport blood towards the heart. And primarily, the blood that is transported by the veins will be deoxygenated blood. The only exception to that is the pulmonary veins, which carry oxygenated blood from the lungs to the heart, specifically left side. Now, the blood has several components, and we're not going to go too deep in the components of the blood. But the blood is composed of plasma, red blood cells, white blood cells, and platelets. And what you need to remember is that the plasma is the fluid portion of the blood, so it's responsible for transportation of the components of the blood. The red blood cells are specific to the process of oxygenation, and they require 4 oxygen molecules to be properly oxygenated, and red blood cells cannot move by themselves. They have to be transported via the plasma. White blood cells are important to the immune processes within the body and infectious fighting infection within the body. And the white cells are able to move to where the issue is occurring within the body. The platelets are important to the clotting process within the body. And that's all you need to know about the components. And that would be it for the circulatory system. Now let's look at the skeletal system. The skeletal system consists of bones and is the supporting framework for the body. It has three major functions that you need to be familiar with at the EMR level. One, it supports the body. Two, protect vital structures. Three, manufacture red blood cells. There are other functions, but you don't need to know that for this particular course. Now, the skeletal system, all of these structures that are depicted here, you need to be familiar with. The skull, clavicle, shoulder girdle, which is the attachment for the arms, the lower extremities. Now, when you look at the skeleton, it is divided into what is referred to as the axial skeleton and the perpendicular. So you have the axial skeleton, which is the center portion, and that's the skull, the rib cage, and the spinal column. Skull, rib cage, and spinal column is the axial. Appendicular skeleton would be the shoulder girdle and the pelvic girdle. The shoulder girdle is the attachment for the upper extremities, and the pelvic girdle is the attachment for the lower extremities. So the skull. The bones of the head include the skull and the lower jawbone, which is sometimes referred to as the mandible. The skull consists of many bones fused together to form a hollow sphere that contains and protects the brain. The jawbone is a movable bone that is attached to the skull and completes the structure of the head. Now, the spine consists of 33 vertebrae. The spinal vertebrae are stacked on top of one another and are held together by muscles, tendons, discs, and ligaments. And tendons connect muscle to bone. Ligaments connect bone to bone. Now, the spinal cord or the spinal cord passes through the hole in the center of each spinal vertebrae, and it exits the skull through an opening referred to as the foramen magnum. Now, the spine has 5 sections that you need to be familiar with. You have the cervical spine, which is the neck. You have the thoracic spine, which is the upper back. You have the lower back, which is the lumbar spine. You have the sacrum, which is the base of the spine. I have the coccyx, which is the tailbone. You need to be familiar with all 5 sections. Very important. Now, the cervical spine has 7 vertebrae. Thoracic has 12. The lumbar has 5. The sacrum or sacral vertebrae is 5. So it's 5 bones fused together. And there are 4 coccygeal fused together. That's the coccyx. Need to be familiar with the spinal column. Very important. Now, the purpose of the spinal column is to protect the spinal cord, and the spinal cord is the link between the brain and the rest of the body. So if you look at this particular diagram, you can see where the nerves branch out of the spinal column to various areas within the body. So if there is a damage that cuts off that link, then there can be issues with movement or functions. Now, the shoulder girdles, Each shoulder girdle supports an arm and consists of 3 bones. So remember, this shoulder girdle or girdles is the attachment for the upper extremities. It consists of 3 bones: the collarbone, which is the clavicle, the shoulder blade, which is the scapula, and the upper arm bone, which is the humerus, or sometimes referred to as the funny bone. The upper extremity, the upper arm, has 1 bone called the humerus. All right. Now the forearm, so let me just backtrack a bit. So please note, the upper arm has 1 bone called the humerus. That's a funny bone. The forearm consists of 2 bones, the ulna and the radius. The radius is in line with the thumb. The ulna is in line with the little finger. So the wrist and the hand consist of several bones. We're not going to go down into each bone and be too specific with the bones of the hands. That's not required for this course. The rib cage has 12 sets of ribs which protect the heart, the lungs, the liver, and the spleen. That's the purpose of the rib cage. Now, still on the rib cage, the sternum is located in the front of the chest. And you can see it on the diagram that's depicted. And the sternum is sometimes referred to as the breastbone. Now, at the inferior portion of the sternum, we have a tip, which is cartilaginous to some extent, which is referred to as the xiphoid or xiphoid process, and that's the bottom portion of the sternum. All right. Now, the pelvis serves as the link between the body and the lower extremities. It protects the reproductive organs and other organs located in the lower abdominal cavity. The lower extremity, each lower extremity consists of the thigh and the leg. And we're going to look at the breakdown for that. So the thigh bone is referred to as the femur, and the femur is the longest and strongest bone in the entire body. So it takes a lot of force to fracture a femur. The leg has 2 bones. These 2 bones are called the tibia and fibula. The kneecap is referred to as the patella and is a small flat bone that protects the front of the knee joint. And the knee joint needs a lot of protection because there's a lot of sensitive nerves within the knee area and ligaments, important ligaments. The ankle and foot contain a large number of smaller bones. Now, joints. Wherever 2 bones come together in the body, a joint is formed. And that joint can have free motion, limited motion, or no motion. We're not going to go into the various types of joints. Just know that regardless of how many joints are found within the body, they fall in 3 categories. Joints that have free movement, like the shoulder joint. Joints that have limited motion, like the elbow joint. And joints that have no motion, like the pelvic joint and the joints in the skull. Now, joints where 2 bones come in contact with each other, a joint is formed. It is held together by supporting tissue called tendons and ligaments. And remember again, tendons connect muscle to bone, ligaments connect bone to bone. And within the joints, there is lubrication or lubricated by a thin fluid that is contained in a sac surrounding the joint. So the joints need to be lubricated in order to encourage good motion. Right? Some joints that you need to be familiar with: fused joints, hinge joints, and ball and socket. And it's really the categories that the joints fall in, as I explained before. Joints with free motion, joints with limited motion, and joints with no motion. And that would be the skeletal system. Now let's look at the muscular system. The skeletal muscles provide support and movement. Alternately contract and relax. And the skeletal muscles are voluntary muscles. There's one skeletal muscle that actually has involuntary and voluntary functions, but we're not going to go too much into that. So there are three types of muscles that you need to be familiar with. Skeletal muscles is the first one. Next one is your smooth muscles. And smooth muscles are found within the blood vessels and within the muscles within the intestines. Smooth muscles carry out automatic functions, so they are involuntary muscles. And then we have the cardiac muscle, which is the heart. So the heart is a muscle. That's why it is referred to as a myocardium. Now let's look at the nervous system. The nervous system governs the body's function. So all of the functions within the body are linked to the nervous system. It consists of the brain and the spinal cord and the individual nerves that extend throughout the body. So you have the brain and the spinal cord, which is a central nervous system, and then you have the spinal nerves and cranial nerves, which are the peripheral nervous system. Now, one thing that you need to be aware of is a reflex, a spinal reflex. And what a spinal reflex is, it simply is a movement within the body that does not require conscious thought or brain function. So it's a response from the body that bypasses the brain. An example of that would be if I pick up an object that is excessively hot. When I pick up that object, I am not going to think about how hot it is. Do I need to let it go? No. What kind of damage is going to happen to my fingers? Okay, I need to let go the index finger. I'm not going to do all of that. Once it burns and I feel the pain, I'm going to immediately release it. So what happens is there are sensory nerves in my fingers which pick up the heat sensation from the hot object and then send that signal to the spinal cord. And when it reaches the spinal cord, it crosses over to what is referred to as connective nerves. And then it goes straight to the motor nerves, back to my fingers, and I release the object. So it doesn't go up to the brain, it bypasses the brain. So that's what a spinal reflex is, or a reflex arc. So the brain is the body's central computer. It controls the following functions: thinking, voluntary actions, and involuntary functions. The spinal cord is a long tube-like structure that extends from the base of the brain. And that is all you need to know about the nervous system. Now, the digestive system. The purpose of the digestive system is to break down food into a form that can be carried by the circulatory system to the cells of the body. The food that is not used is eliminated as a solid waste. Major organs of the digestive system are located within the abdomen. The digestive tract begins at the mouth and continues throughout these structures. So it starts within the mouth, then it passes through the throat to the esophagus, to the stomach where chemicals break it down. Then it enters the small intestine. When it enters the small intestine, that's where majority of the water and nutrients will be absorbed from the food. Then it goes into the large intestine where the remaining water is absorbed, and then we start to get stool forming, which it then goes to the rectum and is removed from the body. The digestive system, of course, is much more detailed than that, but that's the understanding you need at this level. What is important to note is that once the food leaves the stomach and enters the small intestine, majority of the water and nutrients will be absorbed. If it's not, then the stool will be watery, right? And that's why when a person have excessive diarrhea, it is encouraged that they drink stuff with electrolytes in it because they're losing the electrolytes and nutrients through the watery diarrhea. Once it gets down to the large intestine, the remaining water is absorbed, and then we start to get stool forming. Then that passes down to the rectum, to the anus, and it is removed as waste from the body. Not going to get any more complicated than that. Now, the digestive system also includes 3 other organs. You have the liver, gallbladder, and the pancreas. The liver has multiple functions. The gallbladder important to bile, and the pancreas is important to the process of digestion. Not going to go too deep into it. If you want to do additional reading on that, feel free. Now, the genitourinary system. The genitourinary system is responsible for the body's reproductive functions and for the removal of waste products. Major male reproductive organs include the testes, which produce sperm, and the penis, which delivers the sperm. The major female reproductive organs include the ovaries, which produce eggs. The uterus holds the fertilized egg during pregnancy. The egg released by the ovaries travel to the uterus through the fallopian tubes. The external opening of the female reproductive system is called the birth canal or the vagina. Now, the removal of waste products begin in the kidneys. So the kidneys is responsible for removing waste from the body. So it begins in the kidneys, which filter the blood to form urine. The urine flows down from the kidney through the tubes or ureters into the bladder. The bladder collects and stores the urine before it passes out of the body through the urethra. So water is necessary for the kidneys to do what is required. just like flushing a toilet. There's not enough water in the toilet, it can't flush. Same principle with the kidneys. If there's not sufficient water in the body, then the kidneys won't be able to remove the waste from the body properly. Now the skin, which is the largest organ in the body. The skin covers all parts of the body. It has three major functions. It protects the body against harmful substances in the environment. It regulates body temperature, and it transmits information from the outside environment to the brain, and it also plays a function in water retention. The dermis is the deeper or inner layer of the skin, and epi, the prefix epi mean above. Epidermis is the outer layer of the skin, which is located upon the dermis. And there's a nice picture depicting that. Top layer, epidermis, middle layer, dermis, then you have the subcutaneous fatty layer. The skin is an effective barrier to bacteria and viruses as long as it is not broken by injury. The skin can perceive or sense touch, pressure, pain, and degrees of hot or cold. Now, stages of life growth and development. Throughout a person's life, the body changes constantly. In an infant, important things to note, the airway for infants are very small, and because of the size of their airway, they're at a high risk for swelling or objects obstructing the airway. Now, for the toddlers, because toddlers have poor coordination, they don't have good balance, and that's from 1 to 3 years of age. Because toddlers have poor coordination and they are top heavy, meaning them head big, right? Toddlers have big head, them top heavy. They have poor coordination, so they are at risk for falls, and when they fall, they're gonna land head first. So with falls involving toddlers, you need to be looking out for the possibility of head injuries. Now, with your school-age children, they are physically active and prone to injuries from bicycle riding and other athletic mishaps. For your adolescents, they do not fully understand the consequences of their dangerous actions, so them take a lot of risk. In the early adulthood, this is a period when most body systems will be fully developed and functional. In middle adulthood is generally the time when body systems start to decline. During late adulthood, these declines become more pronounced. Now, vital signs. As an EMR, you will be required to obtain some vital signs on the patient. And the vital signs that I will be focusing on for this particular group is the pulse and the respiratory rate. I'm not gonna focus on a blood pressure, so won't be teaching this group how to do a blood pressure, but definitely how to obtain a pulse rate and a respiratory rate for sure. The pulse rate is obtained by counting the pulsation, and the pulse point that is used for patients that are talking is the radial pulse. If the patient is not talking, you use the carotid pulse. To obtain a pulse rate, you will check, you will count the pulsations for 30 seconds. No, sorry, you'll count the pulsations for a full minute, and that will give you the pulse rate per minute. So find where the radial pulse is. If they are responsive, put pressure on that pulse, and it's going to be where the pulse runs over a bone. Once you feel the pulsation, make sure you're looking at a watch with a second hand. Count the pulsations for a full minute, and that will give you the pulse rate per minute. You also need to pay attention to how that pulse feels. Does it feel consistent or regular? Does it feel irregular? Speed up, then slow down. Does it feel strong? Does it feel weak? So that's going to be important. How fast the pulse is? Does it feel strong? Does it feel weak? Is it consistent? For respiration, you simply observe the patient's breathing pattern. You can put the arm across the chest when practicing. It's not something I recommend once you have once you have completed the course. It's not something I would recommend. Oh, right. A normal, hold on, let me backtrack. Somebody asked a question in the chat. A normal pulse rate is 60 to 100 beats per minute for an adult. The younger the patient, the faster the pulse will be. So for an adult, it's 60 to 100 beats per minute. You can have an adult with a pulse below 60 and it's not significant. So persons who are very athletic, persons who do running or cycling, aerobic type activities, play football, they tend to have a pulse rate below 60 and it's fine. But standard for adults, 60 to 100, the younger the patient is, faster the pulse is going to be. For the respiration, you're basically observing the rise and fall. And you count the rise and fall as one. So don't count it separate. Count the rise and fall as one. And you're basically counting the rise and fall of the chest for a full minute. And that will give you the breathing rate for your patient. When you're going to obtain a breathing rate for a patient, do not tell the patient that you're checking their breathing rate. So don't tell them that you're going to check them breathing rate. They're going to alter it once they know you're checking their breathing rate. So what I normally do is I just simply tell the patient, okay, I'm going to be doing some checks on you. And I do my checks. Patient should not be talking to you when you're doing a breathing rate. That will also alter the rate. So definitely we will be covering pulse rate and respiratory rate in the classroom setting. Now, the normal breathing rate for an adult is 12 to 20 breaths per minute. The younger the patient, the faster they will breathe. Now, over time, vital signs will change. So as we get older, vital signs are going to change. A normal pulse and respiratory rates are going to go down. So the pulse will change, the respiratory rate will change, the systolic blood pressure is going to increase. So as we get older, the blood pressure might go up. If we're in good shape, eating healthy, and taking care of ourselves, then the pressure will not increase. But based on the changes in the blood vessels, if we're not physically active as we grow older, the blood pressure will go up. And there are some numbers. Now, variations in normal vital sign values depend on three factors. So there are three factors that can cause changes in a patient's vital signs: the person's size, the person's degree of physical condition, medications that the person takes. Right? These are things that can alter the vital signs. So what this means is you will never look specifically only at the vital signs to determine if something is wrong with your patient. You have to look at the entire patient, right? So don't just look at the vital signs and say something is wrong with this patient because the vital sign is not abnormal. Right? So if a patient has a pulse rate of 60 beats, sorry, less than 60 beats per minute, don't automatically say that, okay, this patient is not doing well. Look at the entire patient. How is the patient communicating with you? Is the airway compromised? Is the breathing compromised? Is the circulation compromised? What is the history? Is it somebody that is athletic? So you have to consider other factors. Now, factors that can change vital signs: increase vital signs. If someone is exercising, their vital signs will go up. If someone has a fever, vital signs go up. If a person is ill, in pain, stress, excess body weight, these will cause the vital signs to go up. Things that can decrease vital signs: athletic conditioning, someone, an athlete, good shape, a patient that is taking medications for their blood pressure, that can cause changes in the vital signs. It doesn't have to be specifically blood pressure medication, but that's the most common example I can think of. Right? And that would bring us to the end of the human body. So, in summary, the respiratory system consists of the lungs and the airway. The circulatory system consists of the heart, which is the pump, and the blood vessels, which is the pipes, and the blood, which is the fluid. The skeletal system consists of the bones of the body. The muscular system consists of three kinds of muscles: voluntary, skeletal muscles, smooth, which is involuntary muscles, and cardiac, which is the heart muscles. And point to note, a muscle is considered voluntary when it requires brain function to move that muscle, meaning you have to think about that particular movement. A muscle is referred to as involuntary when no direct brain function is required. So the brain doesn't have to directly control an involuntary muscle for it to move. It moves automatically. The nervous system consists of the brain and the spinal cord and the individual nerves. The digestive system consists of the mouth, the esophagus, the stomach, the intestines, the liver, the gallbladder, and the pancreas. The genitourinary system consists of the organs of reproduction, together with the organs involved in the production and excretion of urine. The skin protects the body from the environment, and it regulates the internal temperature of the body and transmits sensations from the skin to the nervous system. Vital signs change at different points of the life cycle. All right. Question 1. Which of the following patients is in the anatomic position? You can go ahead and type your answer. All right, I see a B. B as in boy. I don't see any other persons answering. All right, so let's see if you people are correct or not. B would be correct. All right. When referring to the human body, the term proximal means what? So what does proximal means? Yeah. What does the term proximal means?
Sir,
Right.
A, because I can't access my thing, sir. It's Veronica.
Okay. Okay. Let's find out. A as in apple would be correct. So closest to the point where an arm or leg is attached, that would be the proximal portion because it's closer to the trunk of the body. All right. I think this would be the last question. The respiratory system is responsible for okay. D as in dog. All right. Let's find out. D is correct. D is correct. And I think that would be it for this slide.